Welcome to this explainer. Today, we're diving straight into a fascinating and, honestly, highly critical paper by Edward J. Mullen titled Reconsidering the Idea of Evidence in Evidence-Based Policy and Practice. Now, if you've ever wondered how professionals actually decide what policies or social work programs to roll out, you've definitely bumped into the term evidence-based practice, or EBP. But as we're about to see together, the core concept of what actually counts as evidence is surprisingly blurry.
Here's our roadmap. We'll hit the problem with evidence, grab some insights from law and philosophy, reevaluate causal principles, learn how to craft evidence-based arguments, look at a real-world policy example, and finally, modify the EBP framework. Let's get to it.
All right, part one, the problem with evidence.
So traditionally, the idea of evidence-based policy and practice, or EBP, is everywhere in human services. But honestly, it's pretty controversial. The standard way of thinking assumes that practitioners just take research-tested practices and plug them straight into their clinical decisions. It's a neat little system designed to give people the best care. But there's a major catch. It assumes evidence is just a rigid ladder of research, where randomized controlled trials, or RCTs, are perched right at the very top, acting like the ultimate gold standard.
But let's look at a more transdisciplinary approach. Here, decision-making is right smack in the middle of a bunch of overlapping domains. It's not just about what the research says. You've got to juggle client needs, the resources you actually have on hand, and the real-world environment you're working in. Because let's face it, having the highest quality research doesn't mean a thing if it doesn't fit the messy, complicated reality of everyday practice.
Which brings us to a massive, absolutely crucial distinction: efficacy versus effectiveness. Efficacy asks, hey, did this work in a perfectly controlled, totally sanitized experimental lab? But effectiveness, that asks, is this actually gonna work out there in the real world, in a typical, chaotic service organization? A huge mistake we routinely make is taking proof of efficacy and just blindly assuming it'll be effective everywhere else.
Moving right along to section 2, insights from law and philosophy.
So how do other fields handle this? It completely flips the script on that rigid RCT hierarchy we just talked about. Take the law, for example. Legal scholar William Twining points out that evidence isn't just a stack of data points. Data only becomes actual evidence when you can connect it to a hypothesis using a defensible, logical chain of reasoning. The framework itself is the argument. The law doesn't care about a rigid hierarchy of data. It operates on structured, rational arguments based on everyday practical reasoning.
And over in philosophy, we see the exact same pushback against how science uses evidence. In EBP, the dominant theory is called hypothetico-deductivism. Okay, jargon alert. But in plain English, it's the rigid assumption that a data point is evidence just because a hypothesis says it should be. Or that evidence is just anything that bumps up the mathematical probability of a guess. But philosophers like Peter Achenstein argue that's way too loose. Just having a statistical link, a correlation, isn't enough. You need a real logical, explanatory connection to prove why something actually works. Okay, section 3, re-evaluating causal principles.
This leads us to a massive paradigm shift in how we prove a policy actually causes a result. We're drawing heavily here on the work of Nancy Cartwright and Jeremy Hardy. They argue that if you want to predict if a policy will work here in your specific town or clinic, you need way more than just the results of some isolated study done miles away. You have to ask the hard questions. Did it work there? Will it work here? What specific support factors literally have to be in place for it to survive? If you can't answer those, your policy is basically just a shot in the dark.
To get even more specific, philosopher J.L. Mackie gave us the concept of INUS conditions. Now, INUS stands for insufficient but necessary parts of a condition which is itself unnecessary but sufficient. Right, totally a mouthful, but here's what it actually means on the ground. Causes do not act alone. Never. They travel in clusters. For any intervention to work, it has to be paired with a very specific cluster of support variables. Maybe that's specific local funding, or timing, or community buy-in to actually hit the target.
Which brings us to section 4, crafting evidence-based arguments.
So if we know causes live in these messy clusters, how do we actually build a bulletproof argument for a policy? You need a blueprint. If you want to make a rock-solid decision to try intervention X in your town, you can't just slap a single study on the table. You need a core argument held up by specific sub-arguments. You need proof it was efficacious somewhere else. You need proof that the exact same support variables from there are also present here. And you need to prove the underlying causal principles actually apply to your new setting. It's like building a house. You need all the pillars, or the whole thing collapses.
All right, Section 5, a real-world policy example.
Let's look at how this plays out in real life. Imagine this scenario. The Strengthening Families Program, or SFP, is this family-based program to prevent substance misuse, and it was a huge hit in rural Iowa. So officials over in Stockholm, Sweden thought, great, let's put this in our public schools. The big question was, can we construct a rational, evidence-based argument to justify packing up this exact program and shipping it across the globe?
Well, despite all the glowing, systematic reviews showing it worked beautifully there in Iowa, a massive, rigorous, randomized controlled trial here in Stockholm found absolutely zero preventive effects. None. It didn't stop smoking, alcohol, or drug use. The program completely and totally failed to translate. So, let's pull out that argument blueprint we just talked about and figure out exactly what went wrong.
So why the failure? It all comes down to a missing enabling condition. See, in Iowa, a critical support factor was that youth and parent sessions were held back-to-back in the evening. And because of rural dynamics and funded staff, parent participation was super high. But in Stockholm, practically speaking, they just couldn't pull that off. Youth sessions happened during the school day, and parents had to come in separately at night. Because of that, parent participation tanked to 47%. They completely lost the interactive family sessions, and as it turns out, those sessions were an absolutely necessary support factor in that causal cluster. Without those enabling conditions, the intervention itself was basically useless.
And finally, Section 6, modifying the EBP framework. That massive failure in Stockholm perfectly illustrates why we desperately need to rethink how we use evidence in social policy. And this brings us to Edward Mullen's solution. Mullen argues that the old, familiar 5-step EBP process needs a serious upgrade. We have to start formulating warranted, evidence-based arguments. We need to ditch those rigid, inflexible hierarchies of evidence and start looking at the total picture. And yeah, that includes high-quality mechanistic reasoning, meaning we actually need to understand the biological, social, or psychological gears turning behind the scenes, not just blindly trust the statistical outcome of a randomized trial.
If you look at the traditional 5-step EBP process, it looks great on paper. It cycles smoothly from asking a question to finding evidence, appraising it, applying it, and checking the outcome. It's a nice, neat little circle. But you know what's completely missing? A formal step where the practitioner actually stops and builds a justified argument to make sure the evidence makes sense for their specific context.
Now look at Mullen's proposed paradigm shift. This is where the magic happens. The appraisal step now explicitly forces us to evaluate for relevance, credibility, and strength. And the real game changer, right before you apply the intervention, there is a brand new step: form justified argument. This is where you connect the dots. You build that chain of premises and sub-arguments to actually prove, beyond a shadow of a doubt, that what worked there is going to work here.
So, let's wrap up our main takeaways from Mullen's work. Number 1, you have to establish a real explanatory connection, not just a mathematical association. Number 2, the best available evidence shouldn't just be a gold star RCT. It needs to be the total available evidence, including observations and mechanistic reasoning. Number 3, we absolutely must expand our processes to explicitly formulate warranted arguments. And lastly, we need to lean on pragmatic, controlled studies to give us actionable policy we can actually use.
We're going to wrap up this explainer with a pretty provocative thought from philosopher Nancy Cartwright. She points out that if explanatory relevance goes out the window, evidential relevance goes right out with it. Think about it. Without rich local knowledge and robust theory, even the most expensive, highly prized randomized controlled trial won't tell you a single useful thing about what will work in your own community. It really challenges us to stop copy-pasting policies from across the globe and start rigorously arguing for what works locally. Thanks so much for tuning in to this explainer, and I hope it leaves you looking at evidence in a totally new light.